Trying to get pregnant? Find out how making some positive changes to your lifestyle and daily routine can help to boost your chances of conceiving, so you can get pregnant quicker. Remember, it is important that both partners are in the best possible shape, so these tips don't just relate to women. 1. Stop all forms of contraception. It may sound obvious, but make sure your body is free of the pill, any IUDs, or contraceptive injections. You can get pregnant as soon as you stop using contraception, but your periods may be irregular when you first come off contraception methods such as the pill, and you should allow up to 3 months for your natural cycle to fully re-establish itself. Because hormonal contraception stops ovulation each month, your first period after stopping will be withdrawal bleed, and the next one after this is your first natural period. According to the NHS, when trying to get pregnant, it's a good idea to wait until after you've had a natural period. This gives you time to ensure you're in the best physical health for pregnancy and makes it easier to predict a due date more accurately. If in doubt, talk to your doctor. You should also stop using any personal lubricants that are toxic to sperm. 2. Stress less. Yes, someone saying, "Just relax and it will happen," is probably one of the most frustrating things you can say to someone who is trying to conceive. Trying to fall pregnant is stressful enough as it is. But there might a little bit of truth in this piece of advice. More and studies are proving that there is, in fact, a link between stress and infertility. When you get stressed, it can affect the hypothalamus, which is the part of your brain that regulates your hormones. It also controls the hormones required to release your eggs, and men's testosterone levels. Stress can cause you to ovulate later than usual in your menstrual cycle, or not at all. This is known as stress-induced anovulation. Stress can also make you feel less interested in having sex, so if you want to conceive, try and identify what is stressing you. Making some positive changes to your life, such as taking up exercise, attending counseling, enjoy a balanced diet. A balanced diet is vital when you're trying to conceive. Weighing too much or too little can interfere with ovulation, and increase the chances of pregnancy complications and even miscarriage, so if you are concerned about your weight, it's a good idea to work on this before you start trying. While trying to get pregnant, make an extra effort to feed your body the right nutrients to get your body ready for baby making. Stay hydrated by drinking plenty of water and cut out sugary carbonated drinks. You may also like to reduce your caffeine consumption if you drink a lot of tea and coffee, in preparation for pregnancy. Try to eat a nutritious, balanced diet that includes at least 5 portions of fruit and vegetables a day. Go for slowly digested high-fiber carbohydrates such as wholemeal bread and pasta, vegetables, whole fruits, and beans. Slowly digested carbs can boost fertility by controlling blood sugar and insulin levels. Choose healthy fats like olive oil, nuts, seeds, and oil-rich fish, and reduce your intake of saturated fats which are found in processed foods, crisps, biscuits, etc. 4. Cut down on alcohol. According to the NHS, if you're trying to get pregnant or you are pregnant, the safest option is not to drink alcohol at all, which will reduce the risks to your baby. Men should also cut back on alcohol and drink no more than 14 units a week. Drinking too much alcohol may affect the quality of his sperm. 5. Quit smoking. For women, stopping smoking can improve the outcome of fertility treatment, and reduce the risk of miscarriage, stillbirth, ectopic pregnancy, low birth weight, and premature birth. For men, smoking can cause a decrease in sperm count and motility, which also affects the chances of a healthy pregnancy. There is clear evidence that smoking both reduces the chances of successful implantation and harms the developing baby. Some research has shown that women who smoke can be up to 60% less likely to conceive than non-smokers. Likewise, it is equally important that men give up smoking, which is associated with decreased sperm count. 6. Exercise right. Studies have shown that daily exercise can help to improve fertility, so now is a good time to build a routine you can stick to. This doesn't have to be overcomplicated. You could start walking or jogging more, sign up for a local class, or do simple exercises at home. It can help if you have a buddy so you can motivate each other if you're struggling. Don't go overboard, just stick to regular and gentle workouts. Too much intense exercise can interfere with ovulation. 7. Know your cycle. You are most likely to get pregnant if you have sex within a day or so of ovulation, which usually happens about 14 days after the first day of your last period. An egg can survive for about 12 to 24 hours after it's released. In order to conceive, a sperm must fertilize the egg within this time. sperm can live for up to 7 days inside your body, which means an egg is often fertilized by sperm that entered the body before the egg was released. This is known as your fertile window. There are plenty of natural ways of predicting ovulation, such as charting your temperature or cervical mucus, but there is plenty of room for error for even the most dedicated planners. Equally, even with the most regular 28-day cycle, ovulation may not occur exactly 14 days in. Cover all bases by investing in an ovulation predictor kit, which will pinpoint exactly when you are most fertile, and having regular sex throughout your cycle. Ensure you watch our previous videos on fertile window, and also read articles about how to get pregnant on MOXIBER.com. If you have any questions, kindly drop them in the comment section. A doctor will respond in no time. 8. Take your supplements. Though it's not usually necessary to take a dedicated prenatal supplement when trying to conceive, the HSE recommends that women should take folic acid for at least 3 months before becoming pregnant. As well as reducing the risk of neural tube defects during pregnancy, studies have found that folic acid and other vitamins in prenatal supplements may improve ovulation. A study by Warwick University found women taking prenatal multivitamin and mineral supplements were more likely to conceive and to remain pregnant. 9. Have regular sex. If possible, it's best to take a relaxed approach where possible, having sex every 2 or 3 days throughout the month to boost your chances of becoming pregnant. There's no need to have sex every single day, which may just add to the stress, but some studies have shown that the longer sperm stays in the testicles, the higher the risk of DNA damage, so it's best not to wait to have sex only during ovulation. 10. Have a checkup. If you have any concerns, it may be a good idea to visit your doctor before you start trying to conceive. Together you can review your medical history and discuss any potential health issues. As STDs and untreated infections can affect your fertility, it's best to raise any nagging doubts now. With a clean bill of health, you will relax, which in itself is a great boost for baby making. If you've been trying to conceive for over a year, that is for those under 35, or over 6 months, for those age 35 plus, it's important to visit your GP with your partner. This doesn't mean that you won't be able to get pregnant, but it's worth looking into the possible reasons why you have not been able to conceive yet. Watch the next video about the frequently asked questions about fertile period. Remember to subscribe, like and comment. If you have any questions, kindly comment below this video or on MOXIBER.com. A doctor will respond as soon as possible. Thank you for viewing.